Welcome back to Unit 6, I'm GDY. In the last episode,
Cause I'm about that!
we studied the 5 body types with the short latissimus dorsi. Do you want to test your plants to see if the lats are short or longer? Let's study that right now. First, have your plant lie down comfortably. You don't have to bend his legs. Tell your client to bend his arm in front of him and touch the floor with his forearm. His arm doesn't spread wider. If his Latissimus dorsi length is appropriate, his forearm can touch the floor without moving his trunk and pelvis. This shows that Latissimus dorsi, which has a lot of attachment points, including the pelvis, lumbar spine, thoracic spine, and humerus bone, is not short. If his lats are short, he will show you this pattern. First pattern. Your client can achieve 180 degrees of the normal range of shoulder flexion. His lats is shorter than the normal length. Do you remember? The short Latissimus dorsi pulls the humerus back, so it will be limited when the humerus flexes forward. Of course, there are other muscles which can limit shoulder flexion. The pectoralis major, coracobrachialis, and the levator scapularis. We need to consider these muscles. Second pattern. Fortunately, your client's forearm touched the floor. Oops! But your client's trunk lifts off the floor. The thoracic and lumbar spine are extending forward. The pelvis is also not neutral and is tilting forward. His Latissimus dorsi is shorter than the normal length. Do you remember? The short lats makes the pelvis tilt forward and increases the lordosis of the lumbar spine. Let me push his trunk. The short Latissimus dorsi can affect shoulder flexion or movement of the pelvis and lumbar. Try to bend his both legs and hold them in front of the chest. Let his pelvis tilt backward about 20 degrees. As you can see, the degree of his shoulder flexion decreases.
Sneaking through the forest, a vulture circles the sky. Black cat,
Wait, the person who has an excessive forward curve of the lumbar and excessive forward tilted pelvis may complain about pain in their lower back. There is a risk of the disc of the lumbar being overactive. Just be careful. Third pattern. Put your client's arm 90 degrees abduct and bend the elbow 90 degrees and externally rotate. He should have achieved 90 degrees of external rotation. Imagine that his shoulder joint external rotation range is below 90 degrees. The muscles that rotate internally are shorter than normal length. The humerus bone will be limited in external rotation. Do you remember? The short Latissimus dorsi muscle rotates the humerus bone internally. It will be unable to rotate externally to the fullest extent. Of course, the pectoralis major, the teres major, and subscapularis are also internal rotators of the humerus. What do you think? It's not difficult to find the short Latissimus dorsi. If you don't understand, watch episode 20. If you want to be an expert, don't just memorize how. You need to understand why that occurs. Whether it's testing, exercise, or manual techniques, it's all the same. To understand precisely, just one principle is more important than 100 methods of getting rid of shoulder pain. Methods will always change. I hope this video will help you to be a genius of body types. See you soon, guys!